Okay, so this is the pelvic girdle and the lower limb. Pelvic girdle makes up our hip bone, or our hip bones make up our pelvic girdle, and it's actually several different bones. Some are fused, and some just have a joint between them. So we'll actually start with the coxa, and the coxa is made up of three separate bones. You have the ilium, which is the larger flat bone, the ischium, which is the lower posterior bone, and the pubis, which is the lower anterior bone. Things to point out on the coxa are the acetabulum. And acetabulum is the place where the head of the femur, that large leg bone, fits into the hip bone. So this is where the head of the femur would fit into there. You have the, let's go to ilium, iliac crest. So the iliac crest, if you push in on your sides, iliac crest is that large crest that you can feel pressing in on your sides. And then on the other side, you have this is the medial side, you have the iliac fossa, and that's a place for muscle attachment. Okay, ischium. Ischium has the ischial tuberosity, which is the bone that we sit on. So if you think about sitting on a bicycle seat, this ischial tuberosity is where the bone that makes contact with your bicycle seat. Okay, the ischium is also called the sit bone. That's the bone you sit on. Okay, and then the ischial spine is another landmark you need to know. You should be able to identify ischial spine and ischial tuberosity. Ischial spine is more superior projection. All right, pubis. Pubis, we have the obturator foramen. Remember, a foramen is where the muscles and, nerves and blood vessels pass through. Okay. We're going to move this way to finish talking about this. The symphysis pubis is the joint between the two pubic bones. Between the two pubis bones. So the symphysis pubis is this joint right here. And this joint, symphysis pubis joint, can expand during childbirth to allow the baby to pass through. And the other thing to point out here with the pubis bones is the pubic arch. Okay, and it's just the angle made between the two pubis bones. So in a comparing the male and female pelvises, since the female pelvis has to allow for childbirth, it has more flared ilium. So instead of the ilium being, either one would look like this. Instead of the ilium being more upright, the female pelvis, the ilium are more flared, okay, to allow room for the baby to grow and move through. Whereas the male would be more upright. The female is more flared. The pelvic brim is wider for the female pelvis than the male pelvis. You have a wider pubic arch in the female pelvis and compared to the male pelvis. And the sacrum in the female pelvis, the sacrum is oriented more to the posterior, whereas in the male it curves more forward. So for the female, the sacrum would curve more posterior, with the male it curves more to the front. Okay, talk about the lower limb. start with the femur. Things we need to know for the femur, you need to know the head of the femur. So this is the head. And then part of the femur called the fovea capitis. The fovea capitis is a small fossa where a ligament attaches the femur, the head of the femur, into the acetabulum. Okay, other things you have to be able to identify for the femur are the neck, greater trochanter, place for a muscle attachment, and lesser trochanter. Okay, here's a better view of the lesser trochanter. This is B is the posterior view, A is the anterior view. Lateral epicondyle and the medial epicondyles. And then the lateral condyle, medial condyle. And these are what articulate with the tibia. So remember, condyles are these smooth, rounded projections in a joint. And these specifically articulate with the tibia. Okay, and an articulation means it connects with, so it makes a joint with. Okay, the patella. The patella is that sesamoid bone. It makes up your kneecap. Remember, a sesamoid bone is small. It doesn't necessarily be small, but it's a rounded bone that's usually embedded within a tendon. So this patella is embedded within the quadriceps tendon. All right, tibia and fibula. The tibia is the medial bone in the lower leg, and the fibula is the lateral bone. The fibula actually isn't a weight-bearing bone. So some people can break their fibula and still walk on it, albeit probably more painfully, because the fibula doesn't actually bear any weight. Okay, so for the tibia, we're going to point out the medial condyle and lateral condyle, and you can feel these if you move your hands down your knee, or just move a hand on your knee, and you can feel the medial condyle and lateral condyle. The tibial tuberosity is a rough projection where the quadriceps tendon or the patellar tendon inserts, so it connects to the tibia, and this is what allows you to be able to flex your leg, and it will extend your leg. In some people, especially teens, and especially teens who do a lot of jumping sports like basketball, the tibial tuberosity can become enlarged and can become painful and inflamed, and that is called Osgood-Schlatter's disease. Okay, Osgood-Schlatter's disease is just from that overuse of the quadriceps, which causes this tibial tuberosity to become inflamed. For the fibula, you only have to know the head of the fibula and the lateral malleolus. Okay, and the lateral malleolus is that lateral ankle bone that sticks out. Sometimes you hit it on the coffee table in the middle of the night. Medial malleolus is on the tibia. That's on the inside. Okay, so lateral view of the ankle and foot. Once again, for these ankle bones, you don't have to know the specific names except for two. Okay, so the ankle bones are called tarsals. Okay, so there are tarsals, and there's 7 in each ankle. Okay, so each ankle has 7 tarsal bones. These are analogous to the carpal bones in the wrist. The two that you have to know are the calcaneus. Okay. And the calcaneus is your heel bone. And the other one we'll get to in a second. Okay. And the other bone you have to know the name of is the talus. Okay, so calcaneus and talus. And the talus is what actually articulates with the tibia. And then the rest of these bones in the foot are analogous to what you see in the hand. So the 5 metatarsals make up the arch of the foot, and then you have 5 proximal phalanges. Okay, you have then 4 middle phalanges. 1, 2, 3, 4. And then the big toe doesn't have a middle phalange. And then you have the 5 distal phalanges for the toes. Okay, so just to reiterate, you've got 7 tarsals. They make up the bones of the ankle. Calcaneus is the heel bone. Talus is what articulates with the tibia. You have 5 metatarsals that make up the arch of the foot. And then the toe bones, 5 proximal phalanges, 4 middle phalanges, and then 5 distal phalanges.